So my name is Ivor, or as they will call me in my home country of Croatia, Ivor. I do a lot of things, I'm interested in a lot of things, engage in different projects, but basically my main profession is medicine. I currently work as an emergency physician in an ambulance service, so I do spend a lot of time in one of these babies, in the field providing care to patients, which is a great opportunity to use mobile technology. And yes, I want mobile technology, just to be noted, yeah. Okay, and I will show you some examples of how we can use this technology. Doctors are a little bit slow, we are a little bit conservative, but okay, we picked up on this. For example, if we now search scientific medical literature with keywords like mobile phone, mobile health, mobile technology, you will get this upward trend of ever-growing number of research papers about this technology in medicine. Sure, a lot of papers in the beginning, were talking about do mobile phones cause brain tumors and stuff like that. But now, in the last couple of years, majority of these papers really address the issue of how can we utilize this technology to improve the patient care. And we can do this right now in many ways. I will show you examples by going from the most basic features a mobile phone has to the most advanced features. So let's start obviously with the essential feature of every mobile phone, which is the ability to make phone calls wherever you are and you have a network. This seems so obvious and we just forget about this, we don't think about this, but this alone has changed a lot of things in medicine. For example, imagine having a car accident at the road like this in 1980s. If you had a car crash then, to call for help, you needed to find something like this, an emergency SOS telephone. And I wouldn't want to be in your shoes if you see a sign like this, So, but hopefully today you have a mobile phone, so you can, like within seconds, you can immediately call for help, which means basically that the help will arrive sooner, and we know that the sooner we give you help, you have a better chance of survival and a better outcome. Let me back up this by some data from the London Ambulance Service, which is the biggest and one of the best organized ambulance services in the world. When they looked at their data, they saw that in 1999, 5% of all the calls they received came from mobile phones. But this grew substantially, so in 2004, almost a third of all the emergency phone calls they received came from mobile phones, which is very interesting. This number today is probably even higher, and I can tell you that in cases of emergencies happening outside of the home and workplace, this is like 90%. In my ambulance service, traffic accidents, like 90% of traffic accidents are reported using the mobile phone. And when they surveyed these 29% of people, 72% of them felt that in that situation, if they didn't have a mobile phone, it would take them a longer time to contact help. So again, longer time, worse outcome. Okay. Moving on to SMS, the ability to send short messages. A lot of people mentioned these projects in developing countries in Africa to help patients with AIDS, help patients with malaria and so on, so I'm not going to go into that. One interesting example, a very happy story, happened now in the aftermath of the Haiti earthquake, where a student, Maxine Fallon, was rescued after being held for 7 days under the ruins because she was sending SMS. So she was rescued by SMS. They heard her help SMS and they rescued her. Okay, but you may say, oh, this is stuff for developing countries, this is rudimentary technology, what does this do for us in a rich Western country? But you would be surprised because reviews show that there is enough scientific evidence showing us that even in countries like the Netherlands, this is a simple, easy, and cost-effective way to get people to better take care of their health, for example. And it's underutilized, and we should look definitely more into this. But SMS is not just good to notify patients; it's good to notify other medical professionals. For example, the Montefiore Medical Center is utilizing it to help patients with heart attacks. When you have a heart attack, what happens? That a blood vessel in your heart gets blocked. So immediately a piece of muscle dies. But you have another piece of muscle around it, which you can really fight for. It can die, it can live. But it's really time dependent, and you need to do some procedures. One of these procedures can be going in, spreading the vessel open again, for example. So what they saw that when a patient arrives in the ER, in the emergency room, they send a group text message to all the people which will be involved in his care. And by only doing this simple thing, they improved substantially treatment times. So a patient receives treatment faster, which means more of his heart muscle is saved, only by simple SMS. Okay, this can even be further reduced in case of heart attacks, again by mobile technology. For example, you have a first responder, a medical professional who first arrives at the scene. So he acquires an EKG, electronic recording of electric activity of the heart. Then he transmits it, again, using the mobile network. And then a senior cardiologist at the hospital can review it on his mobile phone. This is, for example, what we are doing now. And this further advances the time a patient gets help. Okay, so more advanced stuff like camera on a phone, which is really convenient, of course. And for myself, for example, it's good to document events, not just from like a legal standpoint, but from a medical standpoint. For example, when I have a car crash, I take care to record it, because when I hand over a patient to a trauma surgeon, I like to show him the picture, because from a picture he can learn a lot what kind of a mechanism of injury was present, energy transfer, and so on. But really, camera on a phone can be most useful in my opinion, for remote diagnostic procedures. And the principle is always the same. The concept is always the same, and I'm going to mention the concept on this MOCA project, which was started in MIT to address the issue of shortage of doctors in developing countries. But actually, we have shortage of doctors everywhere, even in Netherlands. So you have an outpatient clinic, and you don't have a doctor there, but you have a volunteer whom you trained to accept and receive patients. So a patient comes, he opens this application, he chooses from some procedure he's trained in, for example, surgery follow-up. So a patient had a surgery 5 days ago, now he's coming for a checkup to see if everything is okay. He looks at the wound, pre-selects, some data, if he has a fever or something else. He records voice notes, and most importantly, he takes a photo of this wound. When he's finished taking notes, he uploads them to a server, and a physician across the globe receives an SMS saying to him, okay, you have 2 pending cases to review. He logs on using the web interface, reviews the case, writes the recommendation, boom, sends the recommendation back to the volunteer in Africa or wherever he is. He opens it up and says, okay, the wound is infected, prescribe this antibiotic for 10 days. So this patient who otherwise wouldn't receive care now received it, and received it really fast. And one doctor can serve like hundreds or thousands of patients. So this is the concept, and the concept is always the same. You just change what you take pictures of. For example, a group of researchers did a really cool thing. They modified the light microscope so a mobile phone can take pictures of the slides. Then they can send them to a specialist who can diagnose tuberculosis, malaria. Now they do a project where, using the same concept, they diagnose eye disease in children in India. So the concept is always basically the same. So advanced feature like camera brought us to advanced modern smartphones like the iPhone. I'm going to talk about the iPhone because it's the phone I use, basically, and it's changed a lot for me. Because when Steve Jobs introduced the iPhone, he said, it is an iPod, it is a revolutionary phone, and it is an internet browser, internet communicator. Because it is an iPod, for example, for myself, it allows me to download hundreds of hours of good quality podcasts and video podcasts. So I can, for example, stay current with the top-notch medical research. I can watch great clinical videos to improve my clinical skills. I can have a privilege to listen to best lecturers from the best universities, medical universities in the world. But what has really pushed the iPhone forward for me are, of course, the app and the ability to install third-party applications on the phone. And now we have around 2,000 great medical applications for the phone, which give me functionalities I could dream of before. For example, some apps turn my iPhone into an e-book reader, so I can carry all the books I ever read in medicine. I can carry them in this single device. Even further, some publishers started to publish like a standalone applications, like these guides from Informed I used to carry with me in my bag. Now I don't carry them. I have them on my iPhone. Also, these fantastic handbooks from Oxford, which are great, and all doctors love them. I used to carry all this in my bag when I went to field. Now I have it on my iPhone. But really interesting are these apps which were built from the base up, you know, which really took advantage of all the things the iPhone can offer. They are really interactive, like this app, which allows me to learn and improve my skills in EKG interpretation, but also is useful when I do an EKG interpretation. Then you have apps, for example, which sharpen my skills of auscultation of hard sounds, for example. But not all is in education. I have apps which help me with a real patient in a real situation. For example, this app shows me normal values, lab values, so I can compare them with the values I got from the lab of my patient. For example, I can do really complex calculations, like perform like really complex formulas to like get to the drug dosages and so on. Really important, I have this for kids. Kids are really tricky to treat, even especially in emergencies, because a 3-year-old is not the same as a 7-year-old, not the same as an 11-year-old. Children grow, they gain weight, they gain height, so the drugs are different. You can really kill a kid in an emergency. So I have an app which will, based on age, weight, length, will calculate medical equipment and will calculate drugs for me in the emergency. Really, really convenient. Then, when I know which drugs I'm going to give, I have another app which shows me if there are some contraindications to give this drug or interactions among drugs. Again, I'm not hurting my patient. But because the iPhone has such a nice, beautiful, high-resolution screen, then you have apps like this, Ozurix, really advanced apps which help you interpret CT scans, MRI scans, because before you needed to have a computer big as half of this room to do so, but now you can do it on a phone. And in the beginning, people thought, okay, this would be cool, you know, I'm at the bedside, I'm showing this to a patient, look, this is your liver, we are going to cut here and so on. but no, really some preliminary data came in that shows that radiologists are just as good to diagnose a disease on the iPhone screen as they are on their terminal, which is crazy. For me, for example, the screen is good to like pre-test visual acuity, color blindness, for example, or even I have an app which can determine if somebody has a hearing problem, just to pre-screen him and then maybe send him, when I get a graph that something is wrong, then maybe send him for further testing. Okay, and this led us to the holy grail of this is convenient, holy grail, with this in the background, of medical informatics, which is the patient record. The patient record, so basically what the patient record is, everything you have about your patient, like demographic data, radiology images, lab values, exams, and so on. So patient records in hospitals used to look like this, and unfortunately in many hospitals they still look like this. But others went towards this, which is like the electronic patient record, so they are trying to become paperless hospitals. And the most advanced are offering their staff this. Okay, so this is the ability to access this electronic patient record using the mobile phone. And one of these hospitals is Doylestown Hospital from the US, which allows its physicians to do just that. I'm going to play a video, short video, let them say what they think about this.
Once the physician activates their phone plan, they come in and we basically just allow them to sync up with our hospital information systems provider. I don't know how it can get any easier than that.
It allows me to access information about my patients. It allows me to get to databases to provide patient care and clinical information, and also allows me to see all the information about the patient that we have in the hospital system.
What they have to do before the iPhone was go to a computer, or they tried to get whatever they could on a paper chart. Now they're able to get that on their iPhone. That is a major workflow improvement for physicians.
I would emphasize the last sentence, workflow improvement. This is really important for doctors, you know. Doctors will accept something if it works well with the way they work. So now finally we have something, you know, really small we can carry in a pocket, but really big and full of stuff and really useful for us to use. Another interesting trend with these applications are applications which allow you to keep an eye on all of your patients anywhere you are. And there is an app from Airstrip Technologies that allows you to do just that. Take a look at this short video.
But you know, what if I'm away from the hospital and all I have is my iPhone and a cell phone connection? Well, now, with Airstrip Critical Care, I'm going to be able to virtually look into that patient's room.
Isn't this crazy? I mean, for me, when I see this, I'm stunned. So, you know, you can see all your patients anytime, anywhere, and this is real-time data, just as if you see it if you stand there and look at the monitor. So I wake up in the morning, I don't brush my teeth, I open my iPhone and see how my patients are doing, you know. And it's really useful because I can see if something is going wrong and maybe prevent it and, you know, help my patients, yeah. Okay. There are other examples I don't have time to show you. So I will just, for the finish, talk about this new trend, let's say, what I call hacking the phone, you know. Giving a phone new features which you never thought were possible before, like this old stuff before wasn't enough, you know. So making it into something completely different. I'm going to show two projects, two ideas. One of them is mine, but I will start one from the United States. So the question is, can a phone be a stethoscope? Even more, can it be a digital stethoscope which will enhance the sounds you hear and allow you to record them? And the answer is, of course, yes, it can. There is an app for that. I couldn't resist, sorry. And a guy from UK, a scientist from the UK developed it. So it utilizes the built-in microphone the iPhone has. So you need to press it against the skin where you would normally place the stethoscope, and it records the sound. Okay, it doesn't work very good because the microphone isn't sensitive enough. But another colleague, a medical doctor from the US, he developed an adapter like this one. So it's an accessory for the iPhone. You plug it in, then to it you plug a tube, and you can use a bell from like an old stethoscope. And now you get really good quality sound. And you get for, I don't know, 10 bucks, you get a good digital stethoscope. Isn't this cool? And you can record sounds, you can share the sounds with your colleagues, they can help you diagnose this patient, you can teach students, fantastic. Okay, other idea is like useful in situations like these. So this guy is lying down, he's unconscious, he doesn't have a pulse, and he's not breathing, trust me. Okay, so this guy is in cardiac arrest. And what you need to do to help him is perform CPR, cardiopulmonary resuscitation, okay? And one of the most important steps in this is to perform chest compressions, so to do heart massage. This is cool, but it would be most effective if you did this in a certain way, following some guidelines, and the guidelines say you need to do this 100 times a minute, and you need to push the chest in 4 to 5, oh my God, 4 to 5 centimeters in. Okay, good. So this is the most effective way, because in this way a patient has the best chances of survival and a good outcome. So this great company called Zoll, which is very famous in emergency medicine from the US, they developed this app which utilizes a built-in accelerometer that is in the phone, which allows it to know when it's changing movement, how fast it's moving, and so on. So if you hold an iPhone with this app while you do CPR, it gives you audio and visual feedback if you are doing it correctly. So audio-visual feedback on the rate, but also on the depth. But as you can see, they recommend that you hold the iPhone like this. It's okay for somebody who will maybe do one resuscitation in 10 years for a layman to have this app. But for me, I have them often, and I need to do them for 30, 45 minutes. It's an awkward position to hold the iPhone like this. So collaborating with a company from my hometown, we came up with a prototype. So I put the iPhone up there. I put it here. I start the app, you know, and I start the compressions. It gives me audio and video feedback. Thank you. Thanks. So I can see the phone clearly, and also very importantly, my hands are in a more natural position. This is a really awkward position. We had to invent something because we have two hands. But now, you know, I can put my hands in a more comfortable position, meaning that I'm getting tired, you know, slowly, which is good, because I will keep doing this stuff in a proper manner. So I brought a girl from home with me. She's called Anne, and she has been to my hotel room, as you can see. But but she's here now. So anybody who would want to try, you just come backstage afterwards, so you can try this. You can even download the app. It's called Pocket CPR by Soul. You can come back. We can try. We can even do a CPR course if you like. Okay. Good. Thanks. So hopefully in my short presentation I did convince you and show you that doctors want this. Where is Nick? Doctors want this, you know, and this is a really exciting field, and we are not so far away from devices like
some tearing of the ligaments.
I don't know. It doesn't show.
Nothing we can't take care of? Good.
There was an interesting. Okay, it doesn't work. There was an interesting video from Star Trek, you know, medical tricorders, which do fantastic stuff, diagnose, treat patients. So this is what we would like in the future, the doctors. Okay, thank you.
I think there will be some questions, Ivor. Anyone? Who's the first one who wants to fire away at Ivor? No one? So let me ask you a question. How many lives have you saved with this technology compared to if you weren't using it?
Oh, okay. So this technology, which I showed, is available in other devices, but they cost a lot of money. Like, for example, these defibrillators. For example, Philips has this technology of Quality CPR in their defibrillators. So there's data, good data of this. It makes a significant difference in the outcome of the patient. For example, when somebody is cardiac arrest, his brain doesn't receive blood. So if you don't do it correctly, you can get the patient, you can get the pulse back, but basically he's a plant, you know, brain is dead. But with this Quality CPR, they measure the outcome of neurological outcome after such an event, and with doing Quality CPR really makes a big difference. You know, somebody walking in the hospital, the other one dies in a coma, you know, so really makes a difference.
Okay,
yeah.
Well, good to know. Jen?
Ivor, hi, I have two questions. One, how much does the prototype cost, and are you looking for funding to roll that out from beyond the prototyping stages?
How much did this prototype cost?
Yeah.
It's a secret. No, I'm kidding. It was done with friends, so we made it like this. We can improve it a lot. When we made it, because I was rushing to make it to show to you, when we made it, we saw, oh, we can improve this, we can improve that, and but it would be interesting thing to make it commercially available, or I don't know.
Yeah.
I think so. Maybe.
And then
I don't know.
how much time does it add to the process to get the device with the support platform ready before you start CPR? 5, 10 seconds?
Something like that. Not significant. Nothing important. Yeah. Yeah. Thanks.
So how many doctors do you actually know that use an iPhone?
Actually, in my ambulance service, I know there's me and another guy.
Okay.
But when they see this,
Did you show them your presentation?
Yeah, when they see this presentation, I think they will reconsider. Okay.
Do we have one more question from the audience? Can you use an iTablet? You have to have a bigger plateau, I think. Okay, so we'll leave the rest for the questions for the drinks. Ivor, thanks again. And,
thank you. Okay.